Welcome. I'm Jenny Miller, the Executive Director of the Global Climate and Health Alliance. I'm very pleased to welcome you to the fifth session of GCHA's global course on certificate program, Global Engagement in Climate and Health. Welcome to those who are taking the certificate, and also to those of you who are just joining us for this session. We have interpretation available in both Spanish and French. In order to turn on interpretation, please go to the globe at the bottom of your screen where it says interpretation. Click on that globe and select the language you'd like to choose. So this session of our certificate program is focused on the latest evidence on climate and health. And we have the great privilege of bringing to you the global and regional findings of the Lancet Countdown. So I'm particularly pleased to be hosting this session. The Lancet Countdown has been around for a number of years now and has just been an absolutely invaluable resource for the climate and health community. You know, some of what we bring to the climate conversation as health professionals and health workers and health researchers is particularly health professionals and health workers bring the stories of the communities and patients that we serve. And sorry about that. As I was saying, what we bring as health professionals, health workers, folks in public health is real life stories of the impacts of climate change on the patients and communities that we work with. But the other thing that we bring is, as trained health professionals and health workers, we are grounded in the evidence. And the Lancet Countdown has been bringing together evidence about the health impacts of climate change, the health opportunities of climate change, and the progress we're making on those things year after year for a number of years now. One of the things that's particularly exciting about this session is that Lancet Countdown has now established regional centers in a number of regions and is beginning to produce regionally focused evidence as well as country-specific evidence. Any number of times that I've been on sessions with those in the health community working on climate change and trying to talk about and advance climate change issues to protect health in their countries, time and time again, I'm told we need localized evidence. We need evidence about our country. The Lancet Countdown is now starting to produce that evidence. So that's going to be a powerful addition to the tools in our toolkit as advocates on these issues to bring this issue to the fore. So without taking further time, I would like to kick off our presentation from the Lancet Countdown team. And I'd like to start out by introducing Maria Wallowender. She is the Global Research Fellow with the Lancet Countdown on Health and Climate Change. And in this role, she coordinates the development, drafting, and submission of the Global Annual Indicator Report. She manages a database of nearly 50 indicators that make up the report and helps to share findings through policy, communications, and data visualization. She also contributes to the report of the regional centers through both technical and editorial support. So without further ado, I'd like to turn over to Maria. Over to you.
Thank you so much, Jenny, both for the introduction and the very kind words about the Lancet Countdown. So I'm just getting my screen going here, so bear with me just a moment. So yeah, thank you again for the introduction, and thank you everyone for joining. I'm really excited to be here today on this webinar. Here's a quick look at what I'll be covering. So I'll start just with an introduction to climate change and health to set the scene. Then I'll tell you a little bit more about the Lancet Countdown and share some of our global findings and highlight along the way how climate change is exacerbating inequalities. So to jump in, We probably hear a lot about climate change, but I think it's important to start with a quick look at what we are talking about. Here we have a graph of CO2 emissions, specifically those emissions that are coming from human activities, including fossil fuels here in gray. This graph's important because it shows how our emissions have really climbed over time, and it's important because the scientific community has long understood that CO2 emissions and the emissions of other greenhouse gases are causing global temperatures to rise. Here we can see that temperature rise. You'll notice a blue line, which is showing expected global temperature rise if there'd been no human activity and no human emissions. We also have an orange line that then shows what scientists estimates global temperature rise would have looked like with both natural and human inputs. Basically, if we take the blue line and we add all those human emissions from the graph on the left, we get the orange line. You'll see that the black line here shows the actual temperature rise that we've experienced, and it overlaps with the orange almost perfectly. This tight overlap is a good visual representation of how human activities have taken us away from natural fluctuations in temperature and instead driven them up and up. So today, when I'm talking about climate change, this is really what I mean. This sharp increase in temperatures that are driven by human activities. This rise in global temperatures has a multitude of impacts on our health through flooding, heat exposure, poor air quality, land use change, and a variety of other climate change effects. People are experiencing heat stroke, infectious diseases, poor mental health, and malnutrition, among a variety of other things as well. Many social factors, such as underlying health status or age, access to health services and infrastructure, can mediate this relationship, which means that some folks are at higher risk. This makes it clear that climate change is a health issue and an equity issue. Actually, a commission brought together in 2009 was just to look at this issue of climate change and health, deemed climate change to be the greatest global health threat of the 21st century. That 2009 commission was actually the starting point for the Lancet Countdown on health and climate change. We're now a group of nearly 300 experts around the world who work on global and regional climate change and health issues. As Jenny mentioned, we publish a global report annually in a medical journal called The Lancet. And our most recent one, which came out late last year, had about 50 different indicators. I'd now like to share some of the findings of our most recent report. And I hope that I can not only emphasize that climate change does in fact pose a great threat to global health, but responding to climate change also presents a great opportunity to improve health. Let's start with something we probably hear a lot about. Particularly for those in the Northern Hemisphere this time of year, we hear a lot about heat. Climate change is making extremes of heat increasingly frequent, and we know that exposure to heat increases the risk of disease and death, with being particularly dangerous for vulnerable populations, including those with underlying physical conditions, pregnant people, and the elderly. We have an indicator that measures changes in heat-related mortality in those over age 65. We've seen that over the last 10 years, mortality in this age group has increased by 85% compared to just the 1990s. This is due to both an increase in heat extremes and a growth in the population of those over 65. We're able to parse this out, and we can see that if temperatures hadn't changed at all and only population had grown, we would have expected about a 38% increase in heat-related mortality. This shows that the 85% increase that we actually saw is largely made up of the impact of heat events. We can also look at infectious diseases. Here we see that the transmission potential for dengue has increased almost 30% since the 1950s, which threatens higher case counts if there were to be an outbreak. We also see that over 10% of the global land area that used to be unsuitable for the spread of malaria has now become suitable in the last decade. As these areas have not had to contend with prevention or treatment efforts in the past, this could leave them unprepared and vulnerable if, or potentially when, malaria starts to be transmitted in those areas. On this note of preparedness, we can look at an effective preparedness measure. That's early warning systems. Early warning systems trigger communication to the public, tell them what is coming and how they can ready themselves. And they also trigger extra preparedness measures within health services and human resources. In 2021, early warning systems were most common for heat-related events and extreme weather events, but there were far fewer that were for foodborne disease or mental health. Let's take a quick look at something called the Human Development Index, or HDI. This is a measure of key development dimensions like standard of living and healthy life. And here we can see that countries with higher HDI scores have more early warning systems in place, while countries with lower HDI scores have fewer in place. This highlights a global disparity, and it's particularly concerning because low HDI countries have historically contributed the least to the problem of climate change, but are also often facing its fiercest impacts, and as we see here, in some ways are the least prepared for them. Moving on to something we can do about it. I'd like to highlight a potential for addressing climate change and reaping immediate health benefits as well. In 2020, the world saw nearly 2 million deaths from the burning of dirty fuels. This includes, but is not limited to, burning fossil fuels and biomass. Transitioning to cleaner energy sources like wind and solar power presents an opportunity to lower overall emissions, those emissions that are driving climate change, and to provide cleaner, safer air in our homes, on our roads, and in our communities. This could help to limit or reduce those 2 million deaths very quickly. However, we again see disparities when it comes to energy. While very high HDI countries have about 11% of their electricity now coming from renewables, this is just 2% in low HDI countries, often due to financial constraints and lagging access to technology. For a just transition to clean energy, we need to take a look at our global systems. This includes how we spend our money. For example, we can look at the continued financial support of fossil fuels through subsidies. Opposed to subsidies is carbon pricing mechanisms, which put a price on carbon-intensive activities, disincentivize the use of fossil fuels, and generate revenue. This indicator here looks at 87 different countries, for each one looking at any carbon pricing mechanisms in place and any fossil fuel subsidies in place. In comparing the two of those things, it's able to calculate a net value, either net subsidy or net carbon price. In 2020, we saw that only 18 countries produced a net positive carbon price, meaning that their carbon pricing mechanisms were bringing in more revenue than any money that was being put towards fossil fuel subsidies. However, 68 countries had a net negative carbon price, meaning whatever was being put towards their fossil fuel subsidies outweighed anything coming in from a carbon price. These net subsidies accounted for $305 billion in 2020 alone. Net subsidies exceeded 10% of national health spending in 26 of these countries, and it exceeded 50% of health spending in 10 countries. This is money that could potentially be put towards health-saving measures. I believe many of the folks on this call are themselves health professionals. While each of us might not be able to directly impact our carbon pricing in our home countries, there is something that can be done close to home in the health sector. The health sector alone was responsible for 4.6 of global greenhouse gas emissions in 2020, and there's a multitude of ways to bring that number down. A WHO program known as ATTACH already has 84 countries who have committed to bring their systems to be more resilient, low carbon, and/or net zero. This is a great sign in the right direction. Through all of this, it's important that our actions be just and equitable. We must remember that the entire world is experiencing climate change with no corner left untouched, but it's not being felt, caused, or responded to equally. This graphic's a little bit old now, but I find it very valuable. On the top, we see countries with relative size showing their relative contributions to climate change, with large countries the ones that have emitted the most carbon. Meanwhile, the bottom shows country size by how heavily they're impacted by climate change, with the largest countries those that are hardest hit by climate change. You'll see that these two maps are often in opposition, with those contributing the most impacted the least, and vice versa. This is why it's crucial to address climate change not only globally, but locally as well. In addition to the global office where I work, the Lancet Countdown has 6 regional centers. These are led by people working in regions who are most familiar with local challenges, impacts, vulnerabilities, cultural factors, political contexts, opportunities, etc. These centers are also the best positioned to affect local change through partnerships and local action. I'm happy to wrap up here and excited to hand it over to 2 of my colleagues so that you can hear directly from these regional centers. With that, thank you so much for your time and your attention. I look forward to the question and answer portion and to the next 2 presentations. Thank you.
Thanks so much, Maria. And that was a fantastic overview from the global perspective. I'm now very pleased to introduce Camila Llerena, who is a researcher at the Klima Center. She's a biologist and holds a master's degree in climate studies from Wageningen University and Research. She has a strong interest in understanding the impacts of climate change on environmental, ecosystem, and human health, and in assessing climate change adaptation strategies in South America. Prior to joining the team at Klima Center, she worked as a researcher at the EcoHealth and Urban Ecology Lab at Cayetano Heredia University. So I'd now like to turn over to Camila to present the results of the Latin America regional report of the Lancet Countdown. Camila, over to you.
Thank you, Jean, and thank you, Maria. I'm going to switch to Spanish now. And I'm going to share my screen. Voy a compartir mi pantalla.
Yeah, I'm going to share my screen now.
Listo. Muchas gracias entonces
Thank
a
you
todos
very
por
much
estar aquí.
for those who are all here.
So, sorry, I am hearing both, also the English translation. Okay, now. I think now it should work. Listo. Muchas gracias a
There I
todos.
am. Thank you very much for all of you for being here.
Voy a comenzar a presentar
I will
el
start
reporte para
by
Latinoamérica.
presenting the report for Latin America.
Es información similar a la que ha
It's
presentado
similar
María,
information to the one that Maria has
enfocada en
presented,
los países
but
latinoamericanos.
focused on the Latin American countries.
Entonces, este es nuestro segundo
So
reporte.
this is our second report.
Y este año hemos
And
ampliado
this
el
year we
ámbito
have
geográfico.
amplified the geographical area.
Tenemos también a México
We
y a
also
5
have
países
Mexico
centroamericanos.
and 5 Central American countries.
También hemos incluido 9
We
indicadores
have
más.
also included 9 more indicators.
2 de ellos creados por autores
2 of
latinoamericanos.
those were developed by the Latin American team.
Dicho esto, paso a presentarles los resultados
Having said
principales
this, I will present you the main results.
para los 5 grupos de trabajo de Lancet Countdown.
5 working pillars.
Entonces, en el grupo
So,
1, que es
in
exposición
group
e
1,
impactos,
which is exposures and impacts,
el panorama realmente no ha cambiado mucho.
the panorama hasn't changed much. The situation hasn't changed much.
Tenemos un aumento en la
We've
temperatura
seen an
constante
increase in temperature, which is constant.
y notamos esto incluso a
And we
pesar
see
del efecto de
even
la
that
niña,
despite the fact of La Niña,
que debería traer
that
enfriamiento para la
should
región
bring
del
cooling to the
2020 al
region in
2022.
2020 towards 2022.
Esto trae efectos en la salud
This
de las personas
brings, it has an
vulnerables
impact
en la
on health
región
of vulnerable people in the region.
y también aumenta
And also
la
it
mortalidad relacionada al
increases the
calor.
mortality related to the heat.
En este caso vemos que
In this
los
case, we can
países con
see
mayor
that
mortalidad
countries with highest mortality
han sido Paraguay, Argentina y
have been
Uruguay y han
Paraguay,
incrementado
Argentina,
en
and Uruguay
140%.
with an 100%, 140% increase.
El clima también es
The
ahora más
climate is
propicio
also more
para
suitable
los incendios forestales.
for
Vemos, por ejemplo, a
wildfires. We see,
Chile
for
con un
example,
importante
Chile
incremento
with an important increase,
y también para los
and
mosquitos, la transmisión de
it's also more
mosquitos
suitable for mosquitoes
que pueden transmitir el dengue.
that
Vemos
can
importantes incrementos en
transmit
Colombia,
dengue.
Perú,
We've seen important
Bolivia.
increases in Colombia, Peru, and Bolivia.
Y bueno, lo que esto nos dice es que
Well,
tenemos que
this
adaptarnos
tells us, of course, that we have to adapt.
y para eso el mensaje
And the
uno que
message
tenemos
here, the
es que
key message
necesitamos
1, is that
políticas
we
intersectoriales
need intersectoral public policies
que incrementen la resiliencia
that
de los países
can
latinoamericanos,
increase climate resilience in Latin American countries
reduzcan las
and
inequidades
reduce
y
inequities
incrementen la salud.
and improve health.
Lamentablemente estamos un poco detrás
Unfortunately, we are a
cuando
bit
vemos el
behind
lineamiento
when
para la
we
adaptación.
look at this alignment for adaptation.
Solamente 4 de los países de la
Only 4
región
of the countries of the
tienen
region
planes
have
de vulnerabilidad y
plans
adaptación
of vulnerability and adaptation,
y 3 de ellos tienen
and
planes
3 have plans
de adaptación para la salud específicamente.
of adaptation for health specifically.
Cuando vemos a un nivel
When
subnacional
we
y
look at the
revisamos las
subnational level
municipalidades,
and we go to the municipalities,
vemos que también muy
we
pocas de ellas,
see that only very few
149
of
para toda
them,
la región,
149
tienen
of the entire
evaluaciones de
region,
riesgo del
have
cambio climático
performed a risk assessment
a nivel ciudad.
of climate change at city level.
Y cuando vemos medidas de adaptación
And when we
concretas,
look at
en este
concrete adaptation
caso
measures,
áreas verdes urbanas,
green urban spaces,
solamente 12 de los
only
centros
12
urbanos de
of
más de
the
500.000 habitantes en la región tienen
central
niveles
urban
moderados
centers
de
have
verdor.
moderate levels of greenness in
Todos
the
los
cities.
demás
All
tienen
the others
niveles bajos o muy bajos
have
en el
very
nivel
low
urbano.
or very low green levels in the urban cities.
Cuando comparamos esto con el
When we
promedio
compare
global,
this with the
para cada
global
zona
average for
climática
each
estamos
climate zone,
debajo también de este
we
promedio.
are below the average as well.
Entonces, esto nos dice que
So
tenemos que
this
involucrar a
tells
otros
us
sectores
that we
también
have
para
to
asegurar
look at other
adaptación.
sectors for adaptation.
En el ejemplo pasado era
In
planeamiento
the
urbano
previous example, it was urban planning.
y ahora nuestro segundo
And now
mensaje
our
va
second
dirigido
message
al sector
is
energía.
about the energy sector.
Tenemos que priorizar una
We
transición
have to
energética
priority energy transition
enfocada en la salud de los
focused
habitantes.
on people's health.
Y nosotros decimos esto para
And
Latinoamérica
we see
porque
this
esta
for
es
Latin
una
America
región
because it is a
que
region
tiene importantes
that
inequidades
has
en
important
acceso a energías
inequalities
limpias.
in terms of access to clean energy.
46.3% de la población rural
46.3% of the
en
rural
Centroamérica
population
y
in Central America and
23.3%
23.3%
de Sudamérica no tienen
of South
acceso
America did not have access
a energía limpia para
to
cocinar en
clean
sus
fuels
hogares.
for cooking in their homes.
Lo que esto trae es,
And
además
of
de la
course,
generación
this,
de gases de
apart from
efecto
the
invernadero,
generation of greenhouse gases,
es
this
aire
also
contaminado en sus
brings
hogares,
contaminated air in
genera
their
neumonía
homes.
y
This generates
enfermedades respiratorias
pneumonia
crónicas.
and chronic respiratory diseases.
Algo similar pasa cuando
Something
evaluamos
similar
el
happens
aire
when we
ambiental, ya no
evaluate
el
the
intradomiciliario.
environmental air.
Vemos que en
And we can see that
Latinoamérica,
in Latin
perdón,
America,
123.5
123.5
muertes prematuras por millón de
premature deaths
habitantes
per
se deben a
million
la contaminación del aire.
inhabitants is due to air contamination,
Tenemos acá
air pollution. We have
una tendencia también al
a
aumento
tendency to grow,
y vemos que
and
en la
we
mayoría de
see
casos esta muerte
that in most
prematura
cases, these premature deaths
se debe a las emisiones generadas por
are
el
due
sector
to the emissions
transporte
generated by the transport sector
y para la energía que se utiliza en los
and
hogares.
by the energy used in the homes.
Entonces, vemos que estamos
So
detrás
we see that
a
we are
nivel de
lagging
adaptación,
behind in terms of adaptation
a nivel de mitigación,
and mitigation,
pero que
but that
la exposición al cambio
the
climático
exposure to
sigue
climate
igual.
change remains the same.
Eso lo que nos dice es que tenemos que
This means that we
asegurar un
have to
compromiso
make
fiscal.
sure to have a fiscal commitment as well.
Necesitamos que los países
We
muestren
need
el
the
compromiso hacia el
countries to
cambio
show
climático
the commitment towards climate change
a través de los fondos que
through
se destinan
funds
a los sectores
that could be
relacionados con la
designated
salud.
to the related sectors that are related to health.
Y ese es el tercer mensaje
And that is the
del Centro
key
Regional de
message of the
Latinoamérica.
regional center here in Latin America.
Vemos, por ejemplo, que debido
We
a
can see,
eventos
for
extremos,
example,
se
that
perdió en la
to
región
extreme events in the region,
15.6 billones de dólares
$15.6 billion
en el 2022
in
y
2022
lamentablemente 93%
were
de
lost,
ellos no estaban
and
asegurados.
93% of those losses were uninsured,
Lo que significa esto es
which
que la
means
carga de esta
that
pérdida se la llevan las personas y los gobiernos
the
en
burden of
Latinoamérica.
these losses are carried by the governments of these countries.
Y no se trata solo de un evento
It's not only
extraordinario que
about
trae
extraordinary
mucha
events
destrucción,
that, of course, brings about lots of destruction,
sino también
but
hablamos
also
de cambios
it is related to
a largo plazo
long-term
que
changes,
generan pérdidas económicas también para las
and
familias
that
en
also
Latinoamérica.
generate problems in the economies for the people in those countries in Latin America.
En este caso vemos
In
la
this case
pérdida
here, we can
de
see the
productividad laboral debido al calor,
loss of labor productivity due to extreme heat,
que se da principalmente en
which
países
is mainly
centroamericanos, vemos
seen
en la
in Central
imagen,
American countries. Here we can see this on the graph.
y los sectores con mayores
And
pérdidas
the
son
sectors
agricultura y
with highest
construcción,
loss are agriculture and construction,
que son también los sectores con
which
mayor
are also the
informalidad en la
sector with
región.
the highest level of informality in the sector, in the
Entonces, el
region.
cambio climático no
So
está
climate
trayendo
change
solamente
is
impactos en
not
la salud,
only
sino también
bringing
en las
impact on
condiciones
health, but
socioeconómicas de las
also in
familias.
socioeconomic conditions for the families.
¿No? En este escenario,
In this
¿cómo
scenario,
motivamos a la acción?
how do we encourage action?
Bueno, nosotros evaluamos
Well,
indicadores
we, of course,
de
assess
compromiso público
indicators
y
of
político.
public and political commitment.
Aquí la imagen es un poco mejor.
Here,
Vemos un
the image is a
incremento
bit better. We see an
en las
increase
publicaciones
in
de los medios de
publications
comunicación
of
sobre
the
cambio
media
climático y sobre
about
cambio
climate
climático y
change
salud,
and climate change and health.
así como también un incremento en
So,
las
and we also
publicaciones
see an
científicas.
increase in scientific publications.
Lamentablemente, solo el
Unfortunately,
4%
only
de las
4%
publicaciones
of the
actuales
publications,
sobre
current
cambio climático y
publications
salud
about climate change and health
vienen de Latinoamérica.
come from Latin America.
Entonces, si nosotros queremos que
So
nuestros
if
tomadores de
we
decisión
want our
tomen
decision
decisiones
makers to
basadas en
make
evidencia,
decision
tenemos que
based on
incrementar este
evidence, we
porcentaje.
have to increase, of course, that percentage.
Cierro con un
I would like to
resumen de los tres
finalize with a
mensajes que
summary of the
presenté.
3 messages that I gave.
Necesitamos políticas
We
intersectoriales,
need cross-sectoral public policies.
acelerar la
We have to
transición
accelerate
energética
the
pensando en
energy
la salud
transition, thinking of health,
y asegurar financiamiento a
and
largo
make
plazo.
sure that there is long-term funding.
Con esto, muchas gracias a todos
Thank
nuestros
you very much.
colaboradores
Thanks. We would like to thank all our collaborators,
y muchas gracias a ustedes por escuchar.
and thank you for listening to me.
Thank you, Camila. Very pleased to hear about that data and those findings coming out of Latin America. Very helpful to understand the region in more detail, and really excited about the specific country reports as well. I think those are going to be extremely helpful for people. So now from the Latin America region, we're going to move over to the African region and hear from Zachary Ali, who is a research fellow working on climate and health at the MRC unit, the Gambia, at the London School of Hygiene and Tropical Medicine. His research interests are in food system sustainability in sub-Saharan Africa. He completed his PhD at the London School of Hygiene and Tropical Medicine, working on food systems resilience in low-income settings. With that, over to you, Zach.
Thank you very much, Jenny, for the kind introduction. I'll pick it from here and give you some details about the health impacts of climate change in Africa. This will be based on the regional reanalysis of the global report of the Lancet Countdown in 2023. I will not just show the bad side, but also highlight some of the opportunities for improvement and opportunities that African nations can take to protect health against climate change in Africa. My presentation will also show how vulnerabilities and opportunities within Africa compared to other regions, similar to what we just heard from Camila about the South Americas. I will start by highlighting some of the direct and indirect implications of climate change on health in Africa compared to other parts, starting with drought, as Marina already presented. The rising temperatures that are the result of climate change, anthropogenic climate change globally, and how it affects different areas of the world differently. These lead mainly to extreme droughts that affect existing levels of high food insecurity in Africa, water scarcity, sanitation, and disruptions in energy generations, especially those dependent on hydroelectric generation. As you can see here, between 2013 and 2022, about 64% of the total land cover of Africa experienced extreme drought. This is compared to 9% when it was 1951 to 1960. So this is a drastic increase and higher than globally, as you can see on the graph. Rising temperatures also pose significant health risks to vulnerable populations, especially older people above the age of 65 who are at a higher risk of death from heat waves. Given Africa's relatively young population, this could mean that there are less deaths in this age group, but we are also losing more labor capacity because people are not able to go out and work in extreme heat. I'll present some of the economic loss data later on. The suitability for transmission of many infectious diseases are also being increased in Africa. And as some of you will know, the infectious disease burden in Africa is among some of the highest in the world. And African governments have been working to eliminate, especially malaria, over the decades in children and pregnant women. And meanwhile, we have transmission season for malaria continuously lengthening due to climate change. So it means that the amount of time that that is suitable for malaria to take place is increasing because of the climate change that is taking place. I would like to now briefly talk about the energy sector and transition to clean energies that hold a lot of potential for health protection in terms of clean energy or even better air quality. The use of dirty fuels in the household sector results in a lot of exposure to toxic concentrations of air pollutants in people's homes. And these are responsible for about 55% of anthropogenic ambient air pollution in low-income settings, mainly by burning biomass and other waste fuels. And we see that in 2020 alone, biomass and waste burning contributed about 84% of household energy consumption in Africa, as you can see in this graph. Only 7% of households use clean energy sources, despite the abundance of natural resources and the sunshine that could be harnessed for clean energy generation. We see that shifting to less polluting fuels like biogas, solar, and electricity can help to reduce some of these burdens associated with bad energy use. Similar to the previous slide, we see that the global share of clean energies in the world is very low, but even much more lower in Africa. Clean renewables accounted for just 1% of energy supply in Africa, and elsewhere there's more generation. And we think that African nations should be able to increase investments in this clean sector, given the abundance of sunshine, natural resources for clean energy, and clean tech. This is actually a huge opportunity for Africa to transition and take advantage of cheap and clean energy alternatives to fossil fuels and biomass use. I would now like to talk about some of the economics related to climate change. We often say in Africa that policymakers and politicians care about two things: elections and GDP. So having a way to link to estimate the economic cost of these can go a long way to getting policymakers to understand what we are losing by not taking action. So I will now like to present some of the economic figures associated with these. And we see that between 2013 and 2022, heat-related reduction in labor capacity resulted in about 161 potential labor hours lost annually per hour in Africa, per person. Africa also saw the highest relative potential income loss in 2022, which is equivalent to about 4.1% of its GDP, with 81% of the potential income losses falling on the generally poorer and least protected agricultural workers. With increasing urbanization and climate risks around, and people increasingly living in urban centers, city-level health and climate risk assessments are essential to protect and inform the people about what is coming and to prepare health systems. However, in 2022, majority of cities that were surveyed in Africa reported that they had not yet completed a climate risk and vulnerability assessment. With the ever-growing climate risks such as heat waves, cyclones, and floods that are hitting African cities, it is essential for African urban centers to step up assessments of health risks to help adaptation and response planning. I would like to end with evidence underpinning climate change and health in Africa and the role of the Lancet Countdown Collaborative Center in Africa in improving upon this. It is actually unfortunate that where climate change is felt the most, the local evidence base and data are scant, as you can see in the graph on your screen. There is actually a huge evidence gap on climate and health research in Africa. More and innovative studies are therefore needed to bring to bear the health impacts of climate change in this region, considering all other local contexts. The Lancet Countdown Center in Africa is the newest that is set up by the Global Lancet Countdown and started operations in 2023. We have plans to fully launch the center later in this year and are calling on researchers in climate and health, policymakers, activists, and practitioners who are working on climate and health in Africa to join hands in this collaborative effort to generate some of the high quality evidence on health and climate change in Africa. I'll end by inviting those who are interested to contact the center, and then thank you for listening, and I look forward to discussions later.
Thank you so much, Zach. And it is really exciting to see the regional center in Africa get started and start start working. Really extraordinary to start having much more focus in the region. So thank you for that presentation. And now we want to open the floor for questions. And while folks are, and so if you'd like to ask a question, just raise your virtual hand and I'll call on you, and then you can unmute and ask your question. And while folks are thinking about what they might want to ask, let me just start out by asking, where can people find the most updated data for their country? One of the exciting things is that we'll now have some country-specific data. So where can folks find those things?
I think you are the one who should answer this question.
Sure. We both unmuted and looked at each other. That's great. Yeah, I'm happy to chime in on this. So, as Jenny's mentioned, and has come up in presentations throughout, the Lancet Countdown, we offer a few different opportunities to connect with local data. And if I can indulge myself to actually share my screen again, I might show you a quick few places on our website that might be really useful. So if you go to the lancetcountdown.org and you click on Explore Our Data over here on the upper right, it actually takes you to a data visualization platform that includes multiple visuals for each of our different indicators. So a lot of the things that we talked about today, maybe heat-related mortality is of particular interest for you. You can come to this page and you can see visually what that looks like. And for a lot of these, there's also maps that it can then tell you a bit about your specific country. So what that particular indicator might mean for the US, where I'm from, for the UK, where I'm based, or for whatever country you're particularly interested in. We also have kind of a growing amount of data sheets, which these are materials that we have particularly prepared to share information for a specific country. So under resources, you'll see policy briefs / data sheets. And here we have, as I said, a growing number of these sheets that are a quick walkthrough of our different indicators for that specific place. So these have been generated from the global team, from the Latin America team, from other regional center teams, to really highlight the most recent and most pertinent data for that country. So those are a couple places I would highlight.
Great, thank you. Looks like we have a question from Justine Namuli. Justine, would you like to unmute and ask your question?
Good evening, all. This in Uganda, it's already evening. And thank you so much. I come from Uganda, and I am representing an organization. I'm a CEO of GCHA Health Ventures, Uganda. So I'm asking a question. This data available, how can it help us as I'm a public health specialist? How can it help us, a public health specialist and a social entrepreneur, in developing my community? And is there any source of information about the funding that could be helping us in doing what we can do best in our grassroots communities that we do? And how best have you based this information on the civil society organizations? Because we have seen most of the time this funding goes on a bigger proportion of maybe the community, the region and the nation, and sometimes it's hard for us to access it. How quick can we access that funding? Because we are already on the ground and we know what people are going through. We are doing it on community and we are the implementers at community level. So how best are you helping us?
Yeah,
Thank you.
Thank you. Great question. Zach, would you like to take a stab at that? And then maybe we could also hear from Camilla. How can this data be most useful to folks working on the ground with communities and how might someone doing the work that Justine is doing access and use this data. And I think that question applies not only for the African region, but also in all regions. So Camilla, you might have some thoughts, and Maria, you might as well.
Yes, thank you. I think this is an important question. What we are seeking to do is to equip the policymakers in different countries, climate negotiators, to have the best evidence at hand so that they can know how, even within the countries, they can apportion more funding into some of these, and also to be able to negotiate for more global funding, since most of the regions have, as we heard from Maria, such as Africa, have contributed less. So to get more from those who have contributed more to that. We also have an indicator on tracking where the funds go, like the Global Climate Fund. And this can be an opportunity to highlight where there are vulnerabilities within Africa, but also they tend to receive less funding because maybe internally they've not set up the systems to be able to compete and get these fundings. So I think it's on different levels, but in the end, it's about empowering country policymakers to be able to understand where the risks are and where the opportunities are to channel funding, and also to get international funds.
Yeah, and I think there's also that value for health workers and health folks working with communities to know what the landscape looks like and what to anticipate. Camila, would you like to take up this question as well?
No, I was going to say that I completely agree with Zach and also with you, Jenny. I think this report gives us a landscape of how the global community is looking at, but also how the regional landscapes. So I think it's also empowering policymakers. And regarding how do we get, or where do we get the information, I would say all our reports are available online, but you can also reach out to the specific centers. We have many journalists, for example, reaching out. They write an email asking for a specific question, and we, as much as we can, we always try to answer. So I think the resources that Maria just showed, the reports that are online, and our emails are 3 ways to find more information.
Maria, did you want to add anything?
I think Zach and Camilla have done a great job covering this, and you've added well as well, Jenny. The only thing I might add is we hear from folks who communicate with us and that we engage with that sometimes having numbers, scientific things to back up the experience you're having can be very valuable. So, Justine mentioned that folks on the ground are those who know what is happening the best, and those who are experiencing every day and seeing those who are experiencing every day how climate change is impacting them. So sometimes it can just be a missing link to then have a piece of paper that a bunch of scientists have put together that they can take forward to whoever they're trying to influence or work with, and can kind of use that as a scientific measurable way to back up the stories that are being felt every day. Sorry.
Yeah, great. Thank you. And I think in our work at GCHA, we've really seen the power of talking to decision makers, bringing those kind of first person stories or the stories from the health workers working with the communities together with the evidence that says, yes, this is the experience, and this is how widespread the experience is, or where this this challenge is going to grow or increase, or things like that. Okay, if I could ask of any of the 3 of you, what are future research trends in climate and health? What are you seeing on the horizon? Where are the gaps? What are the emerging issues that you're seeing in your region or globally. And I also continue to invite folks on the call. If you have a question for any of our speakers, feel free to raise your hand and I'll be happy to call on you. Thoughts on future research trends from any of you? Yeah, Camila.
I can say that research regarding adaptation measures is something that it's appearing now in the research landscape, and it's something we strongly need. Most of our indicators on adaptation are based on adaptation plans and if a country has done or not an adaptation assessment, for example. But we have very few information on what actually works for the different regions and for the different places within a region. So I think that's something that is emerging, and we are happy that it's emerging. And that's also something that might answer Sandra's question on the chat. So we don't have a lot of data on water adaptation measures, for example, and that's why we cannot have an indicator on it. But we are happy to see that there's more research on it time by time, year by year.
Can I just add something to that?
Yeah, please.
Thanks, Camila. I think, yes, evidence on adaptation and what works is really important also for the Africa region. But where we are also seeing the future is real attribution studies. How much of a health burden is the result of climate change in different contexts. And I think there are different efforts across Africa, like the Wellcome Trust has commissioned a lot of studies across Africa, trying to understand how pregnant women that work in the sun, how this impacts fetal development or other birth outcomes. And this is in South Africa, East, and also Western Africa. So when some of these results come in, we can better know how much of how climate change is affecting different aspects. And I think there are other funding calls that come out to try and actually see how much of a health burden is attributable to what part of climate change. So going forward, this is where our indicators will be going, and we can be more confident in our indicators that, look, this is how much climate change is in fact impacting our health.
Thank you. So I'm going to take both of the two questions from folks that have their hands up, take both the questions at once, and then we'll see. We just have a few minutes left, but we may be able to get one or two answers. I'll also note for our speakers that there's some questions being posted in the chat, so we won't have a chance to discuss those, but if you see a question in the chat, feel free to respond there. Sylvia Ferrazi, let's take your question, and then Caroline Getuma, we'll take your question as well, and then see if we can get at least a brief answer to each of those. Sylvia.
Yes, from Medicines for Malaria Venture. I wonder whether actually going forward, can you hear me? Yes, going forward, one of the challenges is indeed, to look at the indicators for adaptation, certainly, but also at the coherence of the data. Because, for example, for malaria, if we look at the scenarios built by the IPCC, we see a clear indication of the fact that malaria will increase with, you will remember certainly the scenarios that were identified, just trying to find it now, but I don't have them on my screen, but basically a major increase in malaria. Now, just recently, I think 2 weeks ago, we had the publication from the WHO task force on neglected tropical diseases and malaria and climate change, together with the Reaching the Last Mile, which shows us much more patchwork and type of contradictory evidence in terms of the trends in malaria, where they say that basically based on the current evidence, we cannot really extract global trends concerning climate change and malaria. Which is very difficult for people doing advocacy at this point because the sources contradict each other. So I wonder whether actually the effort that the Lancet Countdown is doing is also in trying to bring together really the coherence between these different figures.
Yeah, thank you. Great question. Bringing coherence to the data, and particularly, I think at the with the global report. There's been a lot of work on that on a number of issues. Caroline Gituma, please ask your question as well, and we'll see what time we have for at least a little bit of an answer.
Thank you so much for the opportunity. Thank you so much for the opportunity. My question revolves around there are a lot of commitment on the climate health sector, but there's no specific areas where the donors are pledging to give the fundings are saying the exact things they're funding. So from your experience, and if you're to give a proposition on what to be funded, what are the three key areas that you propose for the donors to fund across the region?
Yeah, very interesting question. So where, from the perspective of what you know from Lancet Countdown research, what are the top 3 priorities for funding for climate and health? So we're just going to be able to take super short responses, and then we're going to need to wrap up. Any quick responses to either of those from our speakers?
Sure, I can venture a quick response to the first question, and then perhaps Camilla and Zach will give a quick to the second. So on the topic of coherence on data, particularly when it comes to malaria, I think this is something we come up against in several areas where the data are complex and hard to talk about on a global scale, because as mentioned, there will be places where malaria will become suitable where it hasn't been before. And there could be places where malaria is currently suitable, but may not be suitable in the future, depending on just how high temperatures get. So we do a lot of work in our indicator development and our indicator communication about what exactly that means and how to talk about that and break it down in a way where it's not muddled, that we can't make sense of it, but that in fact we do have a very good understanding of what will happen. It's just that it looks different depending where you are in the world.
Yeah, thank you. And then Camilla and Zach, any thoughts on the second question of research, priority areas for funding, top priority areas for funding?
I would say everything, but if I need to choose, or if I need to see the what's priority for Latin America region, I would say maybe adaptation science. So funds on adaptation science, implementation science on what works, and how to build, for example, resilience in health systems. That's something we are still struggling on. So that would be my choice.
Okay,
Yeah,
and Zach?
Yeah, I'll say all what Camilla also said, and more on attribution and clean energy in the region.
Fantastic. All right, thank you, everyone. We're gonna unfortunately need to wrap up now. Thank you so much to our speakers and the excellent work you're doing through the Lancet Countdown. This data is so needed and so valuable to all of us advocating on these issues, working on these issues. I would like to just tell all our attendees that we have another webinar coming up on the 26th of June next week. Advocating for climate and health action, the essential role of evidence-based policymaking. So it'll build on the discussion of evidence today to talk about the role that evidence plays in policymaking. That should be another interesting session. Thank you to our translators, and thank you to the Lancet Countdown undertaking overall for the extraordinary work that you do year in and year out to bring this important data to the field. And thanks to all of you for joining us today, whether it's morning, evening, or afternoon, where it's always an honor to have a bit of your time to engage with these issues. Thanks and goodbye.